and a palliative medicine specialist. I am section chief of senior oncology here at Levine Cancer. So today we are going to be kicking off our series of patient educational series, focusing on navigating the 4 M's, which are mobility, mind, medications, and what matters most. And this is to empower patients and caregivers in the care of older adults with cancer. So as we know, cancer is a disease of aging. Majority of the patients who are getting diagnosed with cancer are 65 and older. And that's why here at Levine Cancer, we are focused on improving the care of our older adults, and we apply to be an age-friendly health system. So what is an age-friendly health system? So it's an initiative of the John Hartford Foundation and the Institute of Healthcare Improvement in partnership with the American Hospital Association and the Catholic Health Association of the United States. So age-friendly health systems aim to follow an essential set of evidence-based practices, and that's the 4M's framework, to cause no harm and align with what matters to the older adult and family caregivers. These are the 4M's. So focusing on mobility, ability to ensuring that older adults move safely in every day in order to maintain function, focusing on augmentation in delirium, depression, and dementia across care settings, looking at medications to make sure necessary medications are continued, and those medications that are potentially inappropriate are discontinued or decreased in dosing, and also aligning with what matters most to patients and families. This year, I am very happy to share with you that Levine Cancer here in Charlotte and Pineville have received the designation as an age-friendly cancer system committed to care excellence for older adults with cancer. We are among the few cancer centers with this designation and the only cancer center in North Carolina with an age-friendly designation. And this shows our commitment to improving the care of older adults with cancer. And this is because we have the senior oncology clinic. So I am happy to share that as we celebrate this recognition, we are doing a educational series this year every quarter. And for our first educational offering, we are going to focus. So for our first M, we're going to talk about mobility. We're going to focus on the first M, which is mobility. And we have Lauren Kaiser, a physical therapist with our cancer rehabilitation section, who has been practicing for 9 years. She received her bachelor's degree in biology from North Carolina State University and received her doctorate of physical therapy at the Medical University of South Carolina. She is a board certified specialist in geriatric physical therapy and a certified lymphedema therapist. She has worked at Levine Cancer Institute for 2 years, before that at Atrium Health Union. She is passionate about oncology rehabilitation and helping people maintain and or regain their quality of life during and after cancer treatment. Outside of work, she is married with 2 young boys to keep her busy, and she also enjoys gardening, cheering on the Wolfpack, and spending time with family and friends. So everybody, Lauren Kaiser, thank you.
All right, I'm going to take over. So as Dr. Bralamet said, we're going to talk today about mobility as part of the 4M. And we're going to discuss how to prevent falls, move safely, and stay active. So our objectives today are to provide practical strategies for patients and caregivers to address mobility challenges, empower patients and caregivers with the knowledge and skills to actively participate in their care based on their mobility, and to increase awareness and understanding of the mobility portion of the 4M's framework of care in the care of older adults with cancer. So we're going to start with preventing falls. 1 in 4 older adults age 65 and older fall every year, and in the older age population, falls are the leading cause of injury and deaths. Many patients who have fallen do not bring this up at their medical appointments. A fall risk screening should be performed yearly at your medical visits. There's 2 different options for that. A basic one is the 3 key questions, and those are: do you feel unsteady when standing or walking? Do you worry about falling? or have you fallen in the last year? And if yes, how many times and were you injured? If you answer yes to any of those questions, then you would be, the screen would be positive and that you are at a risk for falls. The other questionnaire is called the Stay Independent Questionnaire. It's a 12-point questionnaire with yes and no questions. And if you score 4 or more on that questionnaire, then you would be considered a fall risk. Or if you're less than 4, but you've fallen in the last year, then you're also at a risk for falls. So that 12-point questionnaire is right here. Some of the questions are, have you fallen in the last year, which we spoke about. I have been advised to use a cane or walker to get around safely. Sometimes I feel unsteady when I'm walking. I steady myself by holding onto furniture when walking at home. I'm worried about falling. I need to push with my hands to stand up from a chair. I have some trouble stepping onto a curb. I often have to rush to the toilet. I have lost some feeling in my feet. I take medicine that sometimes makes me feel lightheaded or more tired than usual. I take medicine to help me sleep or improve my mood. I often feel sad or depressed. So both of those questionnaires are something that you could do at home to see maybe if you are at risk for falls. And again, it's something that should be done at one of your medical visits at least yearly. And then if you have a fall, it should be screened at that time as well. So making sure that you are letting your providers know if you have fallen. Based off of these 2 screens, if you were considered to be at risk, then you would be assessed for your modifiable risk factors. You would then further assess your fall risk and then potentially intervene to reduce those modifiable risk factors. And if you are screened not at risk, then still going over effective prevention strategies for falling would be important. So your modifiable risk factors for fall risk, and we're going to talk about the top 3 that are starred today, and then the others will be brought up at some point during these 4 AMS presentations. So the first is to evaluate gait, strength, and balance, to identify potential home hazards, to assess feet and footwear, identify medications that increase fall risk, measure orthostatic blood pressure, which is the change in your blood pressure from going from a lying position to standing, check your visual acuity, assess vitamin D intake, and identify comorbidities. So when evaluating gait, strength, and balance, some of the tools that are commonly used are called the timed up and go, the 30-second chair stand test, the 4-stage balance test, 5 times sit to stand, and a 10-meter walk test. These are sometimes performed, they perform them in the senior oncology clinic here, some of them, to determine your fall risk. A couple of them you can perform at home. So we're going to go over those today. That way you can assess yourself if you would like to see if you're at a risk for falls. And then the others could be used, say you were referred to physical therapy, that these are some of the tests that we use to determine what risk for falls you're at, and then hopefully to see progress made in these. So the first one we'll go over is called this 30-second chair stand test, and this is used to assess your leg strength and your endurance, which both play a role in our balance. The equipment, you just need a standard chair and that has a back and a stopwatch. So you sit in the chair. I'll demonstrate. Oh, that's wheels. Don't sit in one with wheels. Sit in a chair, your arms are crossed, and you set a timer for 30 seconds, and you stand up and sit down as many times as you can in that 30 seconds. And then based off of your age, you can determine whether you are at a risk for falls or not. So simple test for you to do at home to determine that. And the sit to stand is actually a great exercise, which we'll talk about in the future. The other test that you can do at home is called a 4-stage balance test. It assesses your static balance, and the only equipment you need for this is a stopwatch. It's 4 different standing positions that progressively get harder. To do it, you want to make sure that you're standing in a safe area, and you'll position your feet as described while holding on to something, and then once you feel steady, you can let go. So the first one starts with the feet together. Feet there. Get me nice chair. Feet are together, and then you would let go and see if you can hold that for 30 seconds. After that, I'm sorry, not for 30 seconds, for 10 seconds. If you can hold that for 10 seconds, you could grab on and position your feet in the next position, which is the heel of one foot is touching the instep of the other. See if you can hold that for 10 seconds. Switch sides. Again, if you can hold that for 10 seconds, then you would go to the next one, which is tandem stance, and that is heel to toe, basically like you're standing on a tightrope. And then the last one is standing on one leg. For this test, you're considered to be at an increased risk for falls if you cannot hold the tandem stance, which is the tightrope, one foot in front of the other, for at least 10 seconds. So again, just educating you on those, because they are we're actually going to go over those when we go into some balance training. But those are some ways to determine whether you're maybe at risk for falls, and if you maybe need to speak to your doctor about getting a referral for therapy, or maybe trying to take up, do some of the exercises that are at the end, or some of the potential classes that we'll talk about. The next one is improving your home safety. So this is important if you are positive for being at risk for falls, and even if you're not, just to look at your home to prevent future falls. So for floors, we think of using non-skid rugs or removing rugs altogether. You can put the corners stickers on there so that they stay down. They've got the things that go under your rugs that make them less likely to lift up. If you have extension cords or any type of wires in your home, you want to make sure that they're taped down so that it's not something you could trip over. You want to keep your pathways clear of excessive furniture, and then keep your floors clear of things that can trip you, like shoes, any type of clothes. I actually put pets and animals in that section. Just anything that you can remove to stop yourself from accidentally tripping. In the bedrooms, we recommend ensuring that lamps are easy to reach. That way, if you are someone who has to get up in the middle of the night to use the restroom, that you can easily turn on that light, and then also that you have night lights in your room to improve just the visual stimuli in there. For the kitchen, keep your often used items in easy to reach places, so not having them in really high cabinets so you have to get on a step stool to get, or up on your toes. Instead, having them more at counter height, or if you're someone who has issues with the bending, keeping them to where you're not having to get down low to get those. And then never use a chair as a step stool, because it is likely to move. And lastly, for the bathroom, installing grab bars next to the toilets and inside showers, using non-slip mats. Consider a shower chair, not necessary, but something that might make you more safe if you're having some problems in there. And then just being aware of the wet floors if you're walking around in there and maybe someone else is showering. Okay, and then the last one is assess feet and footwear. So shoes that are linked to an increased risk of falling include shoes with inadequate fixation. So thinking about sandals, slippers, things that don't have laces or straps or can easily come off of your foot. Things that have an increased heel height, ladies. Things that have a narrow heel. Again, that would be mainly women. And then shoes that have reduced contact area with the sole and smooth tread. So that would be more shoes that have basically you just need a new set of shoes, that the sole is not, the tread isn't there anymore. I also like to add making sure that your shoes are the right size. If your shoes are too large, then that can be just as cause just as much of a risk if your shoe potentially can fall off And then shoes that are too small can be uncomfortable, and then that pain can lead you to an increased risk for fall. Also, thinking about how flat your shoe is. If you are at a risk for falls, we do prefer a flat walking shoe versus a running shoe. A running shoe has a lip up on the toe. I actually have them on today. I'm not sure if you're going to be able to see it though. Where the toe comes up, and then that it's used in running to help propel you forwards, but when you're standing, it actually forces your weight back onto your heels. And so it kind of creates this rocker bottom, which can make just static standing a lot more challenging. So flat shoes, preferably with laces that are not super old. And then assessing your feet. This is especially true in patients who have been treated for cancer because the potential risk for chemo-induced peripheral neuropathy is higher. The risk for edema is higher. And with edema comes decreased sensation. So assessing your feet for wounds and ulcers, assessing your sensation. You can do this at home, even just testing your light touch, seeing how much you can feel. That can actually pump up your leg some as well. Or that's something that can be formally tested in the doctor's office using a microfilament to see if you have any neuropathy. Edema is swelling of, doesn't have to be your legs, but in this situation, we're going to talk about your feet and legs. So if you're noticing that you have maybe a sock line when you take your socks off at night, or if you sit for a long period of time and you notice that your feet, when you stand up, feel like kind of fluffy on the bottom or heavy, then you might have some edema, and that's something that you could talk to your doctor about. And then based on these items, if you do notice you have wounds or ulcers, decreased sensation, or edema, potentially a referral to a podiatrist. A physical therapist can help with both the neuropathy and the edema. And then just, again, speaking to your medical doctor, because the edema and neuropathy can come from other areas unrelated to cancer, so you need to be cleared for that as well. All right, so that's all I have for fall risk. We are going to move on to move safely, and this I'm going to talk mainly about the use of assistive devices and how to use them safely to ambulate. So we'll start out with a cane. This is appropriate for both a single point cane and a quad cane. So a cane, you want to make sure that you have it at the appropriate height. That is, when you stand up straight, your cane should come right to where your wrist crease is. That way, when you do propel it forwards, your elbow is flexed at about 15 to 20 degrees. So if you put your arms down and it comes up here when you walk, then your cane's going to be way up here and you can't put a whole lot of pressure in it. And then if you put your arm down and it's way down here at your fingertips, then it's going to force you to lean forwards like that picture shows, and you that just puts you at an increased risk for fall and for some back pain. So if you are using a cane at home, making sure that it's set at the appropriate height. Most of them have the bottom that can adjust. And if you have one that is not adjustable and it's the wrong height, then you'll probably just need to get a new one, and a prescription can be placed for that. Proper use for a cane. There's two different ways to use it. So you can use a cane. We describe it as stronger side and weaker side. With weaker, I would also say that as the more painful side. I can step back if you want. So you want to use the cane actually on the strong or non-painful side in that arm. That way that the cane, when it's being advanced, it is supporting your weak or painful limb. There's two ways to use it. You can advance the cane separately from your legs, which would be used if you are having more difficulty. And then you can also advance the cane with your legs if you are more mobile and not having maybe as much difficulty with walking. So I'm going to demonstrate both of those. So if this is my cane, the first option is I move my cane forwards. I step with my weak or painful leg, and then I bring forwards my non-painful or stronger side. Cane, weak leg, strong leg. That allows you, when if I have my cane up here, when I'm stepping, when I should be putting my weight into my weak or painful leg, I now have that cane that I can weight bear on when I'm lifting my other foot. I know it seems a little counterintuitive. A lot of people want to use it on their weaker or painful side. I don't tend to change someone's use of cane if they're comfortable with it, unless they are having some like specific mobility issues, because sometimes that coordination, if somebody's right-handed, it just feels better. I don't want it to throw you off, but technically, if you are having more trouble, that's the way that it should be used. Okay, and then the other option is moving them together, which can be a little bit more challenging. So here's my cane. I would move my cane and my weaker leg at the same time. That just tends to be a faster gait pattern. I'll show that again. Cane and weak leg, and then strong. Cane, weak leg, strong. Again, so you're putting weight through the cane as you are stepping, putting weight onto your weaker or painful leg. And that, again, that goes for both the single point cane, the hurricanes that have the 3 holders on it, as well as the quad cane. I did not write this on here, but with a quad cane, you do want to make sure they're kind of set up. One side is kind of flat, and then the prong's going to come out like this into like a triangle. The flat side should be facing your body, should be closest to your body. That way, you're less likely to trip on it. So, if you're having to switch, if I've just told you to switch which side your cane is on, that bottom is also adjustable, and you can click that and turn it as well so that flat side is facing your body. And all of these are things as well that if you do get, a referral for therapy, that will work to adjust with you as well. A rolling walker is the aluminum walker a lot of people have with just the 2 wheels on the front. The appropriate height for that is if you're standing right at the edge, your top of that walker should come right to your hip joint. So for some people, for me, that's right around my wrist, but for others, it's a little off. So we want that at your hip height rather than at your wrist. And so when you're holding the grips of that, your elbows are slightly bent. With the walker, proper use is to stand at the edge of the walker. So the walker is here. You don't want to start with the walker way out here, because then you're going to end up moving forwards. As you walk, the walker should be constantly moving. That makes sense. So walker, walk, 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 walk. So it's in a nice smooth pattern. Sometimes people do have some issues. Maybe they have more pain and they push and step, which is fine. You just want to make sure that your body should really not come more than a couple inches away from that walker at all times. At no point should your arms be extended. You should still have some bend in your arms, even if you are having to push forwards and step. You want to maintain some of that bend. But in the counterpart, not too much bend. We're not using that walker to put our elbows on. We should still be in a somewhat of an upright position with our elbows slightly bent. I like to tell people to keep part of their body inside of the walker the whole time. If you see this man right here, when he takes his step with his first foot, it's actually going to be moving into this bottom part of the walker here. Whereas this man, if he pushes it there, the walker's going to go forwards, and he's going to end up in a shuffle pattern. And then the next one, the last assisted device we're going to talk about is a rollator, which is very similar to the walker, especially when you are adjusting the height of it. It's the same that you want it the handles to come to your hip height and that your elbows should be slightly bent when holding. Because of the seat, you can't get quite as close to it. So people do tend to be a little bit more forwards with it, which is fine. You don't want to be kicking into the seat there. But as much as possible, you want to stay in an upright position. You're keeping the rollator moving the whole time that you are walking. And you're trying not to let that rollator get in front of you before you start going. A big part of that is making sure that you are up and steady and the walker is static before you start moving. The issue is some people will stand up with their rollator out here and just already start going. And then it's way out in front of you, and they can be harder to control than a regular walker because it has the 4 wheels on it. When it comes to rollator safety, we want to think about that because it does have the 4 wheels, it is harder to control. So you want to make sure that the brakes are on when you go from a sitting to a standing position with that. You want to make sure that the brakes on it are locked and not holding on to both handles of the rollator when you stand. It's okay to hold to one, but the other one needs to be in the chair or by your side. That way it doesn't get pushed off. And then if you are using the seat that is on there, you want to make sure that you push that rollator up against a wall or some type of stable surface before sitting on it, because the brakes are only so good, and the last thing you want is to go to sit on it. Sorry about that. Which one was it? All right, so that's it for the moving safely in regards to the assistive devices. So we're going to talk about staying active, which is what I do. Some of the benefits, not all, but these are some of the benefits of exercise. It helps control weight. It combats health conditions and diseases, including cancer. It boosts energy, improves mood, promotes better sleep, and improves and maintains bone density. So all of these are extra important or are, we'll say, more pertinent to patients who are either dealing with cancer or who have had cancer, because a lot of these things are problems that you are already dealing with. So exercise can help to, combat some of these things, improve some of them, especially when it comes to cancer-related fatigue. One of the biggest things we recommend is exercise, which that would be the boosting energy. It's going to help, obviously, improve your balance based on your strength. And then in regards to the bone density, for those of us that may have some progression of lack of bone density related to our cancer, the exercise and weight bearing specifically and with resistance training is highly recommended for that. The American Cancer Society physical activity recommendations are that theirs is actually for everyone, but specifically adults age 65 and older need at least 150 minutes a week of moderate intensity aerobic exercise, and I'm going to explain what that means. So that 150 minutes can be broken up however you want. If you can only do 10 minutes at a time, then you do 10 minutes multiple times a day to add up to that 150 minutes. And that's just of aerobic activity. That doesn't include the other things we're going to talk about. Or 75 minutes a week of vigorous intensity exercise. They recommend at least 2 days a week of activities that strengthen muscles, and then on top of that, some activities that also will improve your balance. When exercising, especially if you're doing this at home by yourself, you want to make sure that you choose a safe location. You inform somebody that you are going to be exercising, especially if it's new to you. That way someone can check in, maybe call someone before and then call them when you're done. You only want to do exercises that you can complete without increasing pain. It's okay to have a little bit of muscle soreness, but while you're doing an exercise, you should not feel any specific pain, discomfort. That would be a red flag and a reason to stop. and you want to avoid exertion that causes significant trouble breathing, dizziness, or chest pain. Based on your medical history, it may be important for you to monitor your vitals, like your heart rate or your oxygen saturation during exercise, just to make sure they're not getting out of control. But really just listening to your body and, starting out slow, making sure that you're not doing anything that's going to adversely affect you. So we talked about that aerobic physical activity, which they recommended 150 minutes of moderate activity and 75 minutes of vigorous activity. So for aerobic physical activity, it should be doing something that makes you breathe harder and it makes your heart rate faster than it is at rest. That doesn't mean that you can't talk. That doesn't mean that you can't catch your breath. But if you are, just kind of leisurely walking, that's not considered exercise. We have to get the blood flowing, our heart pumping a little bit more to be able to build up and make our cardiopulmonary system work. Moderate intensity activity. If you think of it on a scale of 0 to 10, 0 means that you're just sitting. You're at rest. You're not uncomfortable at all. 10 would mean that you are working as hard as you can. Your score when you're doing that, the moderate intensity activity, should be around a 5 or a 6. When you think about your breathing, you should be able to talk, but you should not be able to sing. So if you're walking around and you're singing, then you're not getting enough, you're not working hard enough. Maybe step it up a notch. Vigorous activity is more of a 7 or an 8, and with that, you should be able to say a few words you should only be able to say a few words without stopping to catch your breath. I would recommend staying more in the moderate intensity for now, unless you're someone who's considered more fit and this is not new to you, and then maybe you can bump up from there. But, going on a walk through the neighborhood, if you're going with a friend, you should be able to carry on somewhat of a conversation, but you should notice that you are slightly winded. Things like mowing the yard, riding a bike, water aerobics, and then some of the classes that they offer here, yoga, Tai Chi, those things would all be included. So the next thing they talked about was muscle strengthening. You want to choose activities that work all the major muscle groups of your body: core, legs, arms, back, and trying to compile those into things that work together. To gain health benefits, when you do muscle strengthening activities, you need to do as many repetitions until the next rep is too hard. You should be able to do 2 to 3 more repetitions, and then you feel like you are at a max effort. I feel like that came out a little scrambled. So you want to start with 8 repetitions of each exercise. If you do 8 and you feel like you could do 15, then it's probably okay to move up to 10 or 12. If you do 8 and you felt like that was absolutely all you could do, then I would back it down to 6. We don't want to be working at a maximal effort all the time. That's too much on our body. We typically say around 60 to 80% of our maximal effort. But if things are too easy, just like we talked about with the singing, with the walking, then we're not getting the benefits that we want out of it. You may be sore with muscle strengthening, but it should really only last into the next day. We say about 24 hours later is the cutoff. So if you start doing a muscle strengthening program and you are still sore 3 days later, then you have done too much. Whether that means reducing your repetitions, reducing how many sets you're doing of an exercise, reducing the length of time, or maybe if you're doing resistance training, reducing your weight or your bands. But that's just a way to know whether you've done too much. We, together as the Secure Oncology group, made these exercise programs. one for beginners, one for intermediate, and one for advanced. These are the QR codes. I'm going to leave them up for just a second while I talk about them. Each of these QR codes will link you to a YouTube video that goes through different muscle strengthening exercises for your stage. So they all include arms, legs, and some core exercises, some with bands, some with weights. The beginners mainly is in sitting. That way, if you are having issues with balance, you can start there. And it also goes over some more safety tips, and it talks about the aerobic exercise as well. So if you're on your phone, you would just go to your camera, hover over whichever one of these you think is appropriate for you, and then click the link, and it should pull it up. And it will be me, about 8 months pregnant. Okay, I can bring this back up at the end if you need to look at it again. Okay, now we're going to move to balance training, which was the other part of that physical activity that they recommended. Each person has 3 balance systems. We have our visual system, our proprioceptive system, and our vestibular system. Our visual system is the easiest to understand. It's our ability to see. Our vision is constantly giving us feedback about where our body is in space, what is around us in regards to our, things we could bump into. It tells us whether the bus that we're on is starting or stopping so that we know how to control our balance. Obviously, as we age, vision is something that declines. That's why the visual acuity is listed on the modifiable risk factors. It is something that you should be getting at least yearly eye checks. That way you know if there are changes to your vision and how to potentially compensate. But it's something that we also work to challenge when we're doing balance exercises, because we know that it is something that is going to decline. So we work to try to build up the other 2 systems so that they're strong enough to compensate for the decline in the vision. The next balance system is called proprioception, and that's your ability to feel your body in space. It's sensation and body awareness. So the sensation of pressure on your feet sends feedback to your brain about where your center of gravity, where you are in space. So it tells you, I can tell by moving as I start to lean backwards, that weight is going more into my feet. And I can feel that without using my eyes or using my vestibular system. And that tells my body how to react. Pull myself forwards, maybe use my hands. You also have, sensation in your joints and muscles that provide feedback to your bodies. They react a little bit slower than our sensation, but it is there. So we talked about the footwear and sensation in our feet earlier. So this would be proprioception. They fall into this region. So again, if you have the chemo-induced neuropathy, if you have edema, it doesn't have to be chemo-induced neuropathy. It can be neuropathy that is diabetic neuropathy. All of those things would play a role into proprioception and would tell you that maybe we need to work to strengthen the other 2 systems if our proprioception is poor. And then the last one is your vestibular system, which is your inner ear. The fluid inside of your ear moves through canals. So when you move your head, the fluid moves, and that communication is given to your brain to tell you, again, where your head is in relation to gravity. So as you move up and down, again, even if your eyes aren't open, your inner ear is telling your body that your head is up, and then that correlates to how the rest of your body should respond. Your vestibular system, of course, can be affected with any type of oncology diagnosis, particularly with any sort of brain primary or metastatic disease to the brain, but also from chemotherapy can cause issues to the vestibular system. Radiation to like the head and neck region will cause issues there as well. So again, not that we can't improve on that specific system, but you want to work to improve the others to make them as strong as you can. Other factors that affect your balance are your strength. Your strong muscles help maintain your balance. The key ones are your ankles, your core, and your hip muscles. Those are the ones that help in correcting your balance when you do lose your balance. Your flexibility, which is the tightness of your ankles, knees, hips, and trunk. And then your endurance. So then that goes back to the aerobic physical activity. So let's go over some static balance exercises. This looks familiar. It's that 4-stage balance test that we talked about earlier, but when we're doing it for a exercise, the goal is to hold it for 30 seconds. So again, with any balance exercise, we want to be nice and safe, standing next to something steady. So this is not going to work. This chair here is more steady, so it will be good standing. I like to tell people to stand next to the sink because it's something that you can actually grip onto. But so you're going to get into the position, steady yourself. Starting with the easiest one, which is the feet together. So starting with your feet side by side, eyes are open. Once you feel steady, you can let go. Now, if I'm just wanting to do regular balance, from there, I can go through those 4 different movements. Again, grabbing on with each one, moving my feet, let go, moving my feet, let go, moving my feet, and letting go. But to challenge those other systems that I talked about, you can start with your feet together, eyes open, and you've got 4 options. You can close your eyes. Now I'm relying heavily on my proprioception, my ability to feel my feet, and on my vestibular system that's telling me, oh, I'm kind of wobbling a little bit. You can keep your eyes open so you're using your vision. You can turn your head right and left. Move your head up and down. Or you could stand on something unstable like a pillow, folded up towel, something that's not going to move. So with each of those, you want to start with the easiest one. Obviously, if you can't hold that position with your eyes open for 10 seconds, then that's where you want to stay. If you can hold that with your eyes open for 30 seconds, then you can try one of those that are listed below. If you notice that you have more trouble, say, closing your eyes, then that means that you are very heavily using your visual system to control your balance, and you'll want to work on doing more exercises with your eyes closed. If you can do that for 30 seconds with your eyes closed, then it would be okay to try the other foot, the second exercise up there with your eyes closed, and see how that goes. So say you know that you already have some decreased vision, or you have a chronic condition where your vision is going to worsen, then you want to start training those other systems, meaning doing things with your eyes closed so those other systems can be stronger. If you know that you have neuropathy in your feet, then you want to do things where you are standing on an unstable surface to build up your vision and your vestibular system. And then if you have issues with your vestibular system, then you want to do things, turning your head, moving your head up and down to help strengthen those other systems. That clear as mud. Dynamic balance is maintaining your balance through movement. Obviously, we aren't just standing still throughout our day. We move. Dynamic balance exercises would be appropriate for someone who does not need an assistive device, the cane, the walker, to ambulate, but may be having some higher level balance problems. You can start simple with side-to-side weight shifting. doing things like a walking march, walking in place, walking backwards, walking the tightrope, and then even doing things like that, the static balance exercises that we went over. Say I'm standing with my feet together, but I'm doing something with my upper arms. It might be reaching. I could be doing some punching. Get somebody to work with you and toss the ball. All of those would be some dynamic balance exercises. But again, only something that you would need to work on at home if you are not using an assistive device, or if you have somebody that is can make sure that you're safe while doing them, or it could be that you're referred out to work on these with a therapist or at an exercise class. We talked about flexibility with balance training, or flexibility as a part of balance. The main muscles that are involved in helping with our balance are our ankles, our hips, and our knees, and our hips and our trunk. So I put up there three basic stretching. His leg there, so it's just on a wall. You can do it on the counter. Step back and feel the stretch in the back of your leg. If we're very tight in our calves, it pulls our body backwards and makes us want to lose our balance in a posterior direction. Our hamstrings, which connect from here down to the back of the knee. Stretch this one. And sitting on the edge of the chair, nice and upright, putting one leg out and getting that knee as straight as you can. I'm already feeling it there. Got my toe, instead of having my toe relaxed, I have my toe curled towards me a little bit. But say you are not feeling it there, then you do have the option of leaning forwards a little bit, just not coming into this position. You really want to be bending through your hips, and that's stretching both my hip and my knee. And then the last one is that guy's lying down and he is pulling his knee towards his chest, and we're stretching our hips and our knee and trunk, lower back there. For all stretching exercises, the goal is to hold for at least 30 seconds and then perform 2 to 3 repetitions. If you're only holding for 10 seconds, we're really not getting a lot out of it, and you really want to avoid any of that like bouncing motion, because that's just taking your muscle in and out of a stretch. We like a long, sustained stretch to actually get a change.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.